I've been eating well for quite a while now, and I don't see a lot of big changes on the scale. What do I do to keep myself motivated? Hi, I'm Dr. Cammy. This is Dr. Cammy Goes Keto, and I'm here to tell you about 3 things that you can do to try to keep yourself motivated before the weight loss comes off on the scale as you're trying to eat better and have a healthier lifestyle. So, hopefully, the way that you're doing that is through therapeutic carbohydrate restriction, we call it, or TCR, and watching your carbohydrate intake. This is a very difficult thing to do in today's society because they're everywhere and they taste wonderful and delicious and yummy and keep you addicted and make you want to eat more and more and more because that's what the food designers do. So you have to be very mindful of that. And the way that I've been able to tackle it, since I'm basically addicted to carbohydrates and sugar, is through complete abstinence. So that seems like such a strict thing to do, to have no sugar, no flour, and also no caffeine. But what it's been doing is allowing me some freedom, believe it or not, because I just don't entertain the idea of eating those things. If I'm hungry, I eat other things. So I'm going to talk to you today about 3 different things that you can do before the scale changes for you. The first thing that you can do is you can measure your waist circumference. And so usually that's the smallest part of your body between the lower portion of your rib cage and your hip bone, your anterior superior iliac spine. So what you do is you find where your hip bone is and you find the lowest rib and you go in the middle of that. That's the proper way to measure your waist circumference. And generally you want it 31 inches, 31 and a half inches or less is ideal. And if you have a waist circumference of 30, greater than 31 and a half up to 35, that's increased risk. But if your abdominal circumference, your waist circumference is greater than 35 inches, then that gives you high risk for cardiovascular disease, stroke, metabolic syndrome, insulin resistance, all of those unhealthy things. So mine right now is probably about 41, and I started out at 47. So it's coming down slowly, but I'm still needing to lose a lot around my waist. So I know my work is not done. The other thing you can do is you can look at your height to waist ratio, and you look at it in inches. So if you are like I'm 5'5" tall, so I'm 65 inches tall, and you divide that by a half, you divide that in half. So my waist circumference should be 32.5 inches or less. So that's what I'm shooting for. So that's the first thing that you can do, is just measure your waist circumference every week. It's cheap, it's easy, and you can follow what's going on with that, or maybe even 2 weeks, or maybe even once a month. You don't have to measure it all the time. The second thing that you can do is look at your triglyceride to HDL ratio. This is going to require blood work. But you look at that in milligrams per deciliter, and you divide the triglycerides by the HDL and look at that ratio. And you ideally want it less than 1 if you're a male and less than 2 if you're a female. That's very good. If your ratio is 2 to 3, then that means you're at slight risk for insulin resistance. If your ratio is greater than 3, you probably are insulin resistant, which is a metabolic marker for poor metabolic health. And if it's greater than 4 to 5, you're in metabolic dysfunction. So my last ratio was 4.5, so I am still in metabolic dysfunction. But I've actually had triglyceride to HDL ratio as high as 9. And the reason why is because my HDLs are really low. I think part of it's genetic. Both my parents had low HDL. And part of it is because of my poor metabolic health. But it is improving. So that's a thing that you can look at. And then the third thing that I'm going to talk about is your fasting insulin level. So along with a fasting glucose and a hemoglobin A1C level, you can draw a fasting insulin level and look at that. There's also, so for a fasting insulin level, ideally, I'm shooting to get mine less than 10. I want mine below double digits. Mine started at 34, then it went to 28.6 or something, and now it's 16.8. So even though I haven't lost a lot of weight on the scale, you can see that metabolically I'm improving. And I have to tell you that I have lost some weight. I mean, I've been working with Jeff, my nutrition and fitness coach, and doing weight resistance training and pinching my fat and measuring my muscles for almost 3 years. In September, it'll be 3 years. And I have lost 30 pounds total. So it is coming off slowly, but that's just something that you can look at in addition to the triglyceride to HDL ratio and your waist circumference. You can check out your insulin levels. I think that everybody should know what their insulin level is and whether or not they have insulin resistance. Insulin resistance and checking your insulin levels is a really good way to check and see if you're pre-diabetic. And diabetes is such a prevalent disease and and obesity in the United States right now and worldwide, but especially here in America. And you can work on lowering your insulin levels before you get diabetic. Like right now, I am not diabetic, and my hemoglobin A1C was never above 6.5, but boy, did it get close there to make me a diabetic by definition. But now my hemoglobin is 5, and it's the lowest it's ever been. Now, probably some of that is because I'm on the GLP-1 Zepbound, and that can lower your hemoglobin A1C. So in order to kind of jumpstart me and help me in my weight loss efforts, I'm on the Zepbound, and my goal is to try to not binge eat. That is my biggest goal. And once I've gone 6 months without binge eating, which will be coming up in November, to look and see what's going on with my weight loss and maybe stay on the Zepbound for another few months after that. I'm not sure. I'm just playing it by ear. But there's also this other thing called HOMA-IR, HOMA-IR. And your HOMA-IR, HOMA stands for Hemostatic Model Assessment of Insulin Resistance. And so you look at your hemostatic model assessment of insulin resistance by multiplying your fasting insulin by your fasting glucose, and then you divide that by 405. So it says here, you can see here that you take your fasting insulin, times it by your fasting glucose, and then divide it by 405. And you want to try to have that result less than 1. That means that you're in excellent insulin sensitivity. If it's 1 to 1.5, you're very good. If it's 1.5 to 2, you're in mild insulin resistance. If you're 2 to 2.9, insulin resistance is likely. And if you're over 3, then you have significant insulin resistance. And I figured out my HOMA-IR the other day, and my HOMA-IR is 3.7. So I'm definitely having some insulin resistance. But I'm sure that before, when my insulin was higher, it was definitely higher. So yeah. So I want you to just be aware metabolically of things that you need to be looking out for. And a waist circumference, your triglyceride to HDL ratio, and insulin levels are things that I just want you to be thinking about, reading about, checking out, looking into that with your provider. A lot of healthcare providers will order your labs for you if you ask them about this, and you can just say, hey, I've done some research on metabolic health and I'm interested in checking my fasting insulin with my next set of fasting blood work. The other thing that you can do is you can order your labs yourself. You can order them online. There's laboratories online where you can order your own labs, and then through Quest, you can go and get the blood drawn. You don't need a physician order for some of those, labs to check yourself, but you need help with the interpretation of the labs. So yeah, I can help you do that. If you want to go to my website, CamillaMcGrath.com, send me a note. I'd be happy to do a quick little consult with you and see if there's anything else that we want to do further from there as far as coaching or helping you stay motivated when the scale hasn't shown yet what you want to see. All right, everybody, take care, and we'll see you next time. Bye.